So let's have a look at what is going in Europe nowadays and in the future. Yep, okay. So unfortunately, I have some bad news for you because there is definitely nothing new regarding non-bioresorbable technologies. So we are almost at the end of the presentation, at that point. But, to be assured, there is also something that we have to think about, that the majority of the devices, and we are talking definitely for non-bioresorbable because we have a lot of new technologies going on, are not supported by the study. Definitely you remember, a couple of minutes ago, we heard about the Tibial trial. This was, another negative trial for the use of drug-eluting stent below the knee. And obviously, there's a open discussion why we have so many negative aspects or negative results. But we have also something good that, in my opinion, this is the only new devices non-bioresorbable for below the knee is the medical micro stent. It's not as special for Europe because it's already ongoing in US in dedicated center during the study. This is a dedicated stent designed for below the knee. The main characteristic is nitinol together with a woven design. The platform is very small. This is a 3 French delivery system, and this gives you the possibility to work also in small vessels. Very nicely, the stent could be visible under IVUS, and this gives you also the possibility to deploy the stent under ultrasound guidance, so you can save contrast media, you can improve, the quality imaging, and also there is a good combination of radial force. So heavy calcified lesion, this could be a good option to use. This is just to recap, the main characteristics of the device. We believe that in the future, maybe we can have better results. We can combine flexibility. We have a kink resistance, so we can use in a heavy calcified lesion. There is a good conformability and also visibility. That sometimes is something that we miss when we work below the knee. As I told you, there are a couple of studies going on, 2 of them in the US, 1 in Europe. All of them, they are looking, for the efficacy and the safety using this micro stent. These are the characteristics, and you see also the large use of IVUS during the procedures. Just a couple of cases. This was a Rutherford 4 patient, with a 90% stenosis. You can see there of the tibio-peroneal trunk. This was treated with a 3x4 millimeter micro stent that was deployed by Antegrade. And what is interesting, you can see the follow-up. There was an improvement of the Rutherford classification from 4 to 1 after 1 year. So pretty nice results at the end of the procedure. Another case is again a Rutherford 4 patient with again a severe lesion on the posterior tibial artery. Again, a 3 millimeter by 4 millimeter microstent was deployed, and also in this case you can see this is just a shorter follow-up, 6 months, but again there is an improvement of the Rutherford classification. Another case, again, Rutherford 4, 95% stenosis of the posterior tibial. Again, this was treated with a 3 millimeter, no residual stenosis. You can see also in the center image, pretty clear visibility of the stent. Very useful, the duplex evaluation. You can see how better improvement of the patients, during the follow-up. Another case of a short lesion in the ostium of the anterior tibial. This is a typical lesion that we can find in our daily practice. This was treated, and again we have, from Rutherford 4 to Rutherford 0 after 6 months. So a pretty good possibility for our patients. Now, something that I would like to stress and to put on the table for the discussion maybe is what about also the DCB? Because obviously this is a non-bioresorbable device that we are using more in Europe. We have several studies going on for this. All of them are more focused on limos, sirolimus, to see and compare to paclitaxel. And this is, for example, the LIME study that is in a randomized study, more than 230 patients, combine the Magic Touch, this is a sirolimus-coated balloon, versus standard angioplasty. Patients are still recruiting during this phase. Another study is the leg DEB 2. This is a study that was designed to evaluate the leg flow drug-eluting balloon. 512 patients that were evaluating an observational study, a prospective one, and the efficacy could be the endpoint, and we are waiting for the final outcome. Another one is the Sirona. This is a very nice study comparing Limus Magic Touch balloon versus the standard regular paclitaxel DCB. Almost all the patients have been recruited, 478, and we are looking for the final results with the absence of clinical-driven TLR after 1 year. And then there is the SIR-PET. This is a one-to-one randomized study for non-inferiority, going to evaluate again, the Magic Touch Limus device versus the standard balloon. And again, you can see that the majority of the focus is for new drugs applied to the standard balloon. Now, something again to evaluate is also, in my opinion, why so many studies failed in the below the knee region. Definitely, this is maybe for a technical expert, or maybe also the design of the study was not the ideal one. So in my opinion, we have also to think about how to design the future studies just to have a better improvement, because there are still a lot of debates regarding the vessel preparation. We have to just perform a debulking or just to perform a single pole dilatation of the vessel. Also, the time of inflation is something that we have to consider. Long inflation, long deflation of the balloon, keep the balloon inflated for a longer period. If you remember a couple of years ago, Dr. Mikari stressed the concept that maybe 5 minutes inflation below the knee is better than the standard 3 minutes inflation. And then also how to evaluate the patients, duplex, clinical. But what is important, in my opinion, that we have to consider that the failure of all these studies is the clear, stress the concept that these kind of patients are very complicated. We have very complex patients that must be managed not only by the interventionalists, surgeons, interventional cardiologists, radiologists, but by a multidisciplinary group of physicians. So in conclusion, at the moment there are no new bioresorbable drug technologies in evaluation. The research is more focused on different drugs or for balloons and stents, but also on bioresorbable devices. We are a little bit afraid in Europe because we know that the future guidelines or rules for the European community can reduce the possibility to experimental work in our countries. The failure of the older studies definitely stress the concept that we are dealing with a very complex type of patients, and at the moment we don't know exactly which is the most ideal treatment modality for this situation. Thank you for your attention.